Last year, I would say it was a record year as far as the number of folks that we saw come through, both combining our telehealth visits through the emergency room and in-person visits in the emergency room, combining both of those together. It was a record year for folks seeking emergency services. We also provide online screenings for the community where folks can go on if they're not quite sure, if I have depression, anxiety, substance use, whatever it might be. You can go take a free confidential online screening on our website. And the only thing I get from that is a monthly email saying this is how many people accessed the site and took a screening. Last year was a record number for the number of folks accessing the screening tool and taking a screening. So I think that was true for the last 2 years. 2 years ago was the most. Last year was even more, and I'm starting to see this year it's even more. And we're just seeing that across the board, that we're just seeing more people reaching out for help. And I see that as a sign of strength. For years, we have one of our goals, since I've, as I said, I've been here 25 years, May is Mental Health Month and October is Mental Illness Awareness Week. Our goal has always been to dispel the stigma around mental illness, that mental illness is no different than if I were to have diabetes or heart disease. If my doctor were to tell me that, Dave, I think you have symptoms of depression, you need to see that, I'm going to make you an appointment tomorrow with the psychologist. You need to go to that. Or Dave, you have symptoms of heart disease, I'm making this appointment with a cardiologist. 20 years ago, if we were to run a study, very high percentage of those patients would go see the cardiologist. But with the depression, only about a third of those were going to see that psychologist. And what we're seeing is that it's still not where it needs to be, but we're seeing more and more people taking that advice or taking that next step to take care of their mental wellness. The other piece of that too is that I think individuals, what we're seeing is that individuals with heart disease or cancer or any other type of physical illness, they have a higher rate of mental illness. And what we're seeing is that if folks don't take care of that mental illness, then they don't have the motivation or energy to follow the treatment plan for the cancer or the heart disease. And so their longevity of life goes down. But if they're treating both of those at the same time, they do get help for the mental illness and the depression, then they have the energy to take care of the heart disease or the cancer diagnosis, and their longevity of life goes up. So it's that what we call integrated medicine, integrated care,